Hello everyone, Steve's here, coming to you from the Nutrition and Health Center, where we provide hope for healing and healthy solutions for abundant living. These solutions today we're going to talk about in this presentation. Let me pull up my message for you and we will get started. It's all about your immune system. And if I'd have known how to test and know my immune system, I wouldn't have had to suffer all those years with an autoimmune disease, ankylosing spondylitis. They diagnosed me in 1983 and said I'd spend the rest of my life in a wheelchair. But I come to you to share much of this wisdom, not just on the perspective of what healed me, but what is involved in healing for everyone, knowing their immune system. And so you see this teetering balance between defense and repair, which is so important that we understand how the immune system is there for us to defend and repair. We're going to discuss the human innate immunity, the human defense and repair systems. We're going to talk about the result of an overburdened immune system, what happens, hidden delayed hypersensitivities and allergies, and a comparison of delayed hypersensitivity testing that's available out there for you today. The immune system consists of adaptation or adaptive immunity and innate immunity. The adaptation immunity is this second line of defense that protects us from exposures. Defense cells in the blood like B lymphocytes to build antibodies, defense cells in the tissue such as T lymphocyte. And the innate immunity is the first line responders. They're non-specific, where the adaptive is specific. They kill bacteria constantly. They are protecting us even on the outside of our skin, the mucous membranes, even in our eyes, and every surface that comes in contact with our outside world. This is our first attack in the tissues of scavenger cells, where they come from. So we want to make sure that innate immunity is doing what it's supposed to. Involved in the skin, the upper respiratory tract, the GI tract. It's non-specific. It provides immediate defenses to any threat, equally beginning with the first encounter. Its main job is to eliminate most foreign invaders before they can venture into your body. The adaptive immunity, however, has a natural and artificial means. We discussed briefly the artificial because this is the methodology that's going on in America today, concerned about viruses. We develop artificial immunes of immunization through various forms, and your body has this passive way to antibody transfer. But God designed it naturally in a passive manner from our maternal gifts that God has given us through our parents, and it is involved in active infection dealing with on a constant level. It will always be adapting to what it sees to protect you. The blood and lymph systems are involved with this. They utilize memory cells and antibody mechanisms attacking specific pathogens that are there, including all types of viruses, cancer cells, and invading organisms that have their ability to mutate and adapt as viruses do. Their main job, attacking invaders, any of them, that have passed through your first line defense of your innate immune system. The adaptive immune response utilizes cell-mediated and antibody-mediated responders. The cell-mediated are the T lymphocytes, T standing for the thymus gland. They are the ones that migrate into the lymph nodes. They are antigen stimulated, and these are our cell-mediated immunity. The antibody-mediated immunity is our B cells. These come from your bone marrow, and these migrate to lymph nodes as well. They're also antigen stimulating, and they are antibody-mediated immunity that we need to keep protecting us. Keep healthy, finding out how it defends us. So our innate system is constantly itself to stop most all invaders. And those are things that weren't originally designed to be coming into our body anyway, which are medications made of synthetic compounds, infections, pathogens, parasites, chemical toxins, hormones, allergens, injuries, stress. There are many. The immune system could defend and repair, but often this underburden of constant defense mode that takes place causes a repair function that's postponed, leaving the body vulnerable. We then have a repair deficit, so the repair doesn't take place. Inflammation becomes then chronic and constant. It can lead to these conditions: asthma, arthritis, diabetes, migraines, eczema, IBS, MS, multiple sclerosis, bloating, cardiovascular disease, and so many more. The arthritis, again, that I suffered with so greatly, I'm very familiar with. The Elisa test has been very helpful for me to stay out of inflammation. I do these tests ongoing to identify what my needs are so I don't get in trouble because of chronic consumption of things repetitively. We do tend to do that, and we want to guard against that so we can identify what our body is not handling well. The first line of defense in the innate immunity is found within the intestinal lining. In a case of a leaky gut, we are looking at the villi that become damaged in the gut wall that allow food particles to come in and nourish our body. When this inflammation occurs, we see this damaging of intestinal lining cells, as you see on the right-hand side of the slide. The leaky gut then picture that's blown up down below shows that toxins, undigested food particles, yeast, fungi, all these organisms then are going to proliferate into the gut stream, through the gut stream, actually into the bloodstream. And once in the bloodstream, then we've got this systemic effect everywhere in the body, from joints to muscles to soft tissue everywhere. We need to guard against that and let our immune system do its job. Hypersensitivity and allergy, these categories that are involved, you see this wheel, we call this the immune wheel. You have the different categories of responses of your immunity. Down below you see the type 1 IgE, immediate responses. Most people know what these are. These happen when you pet a cat and you sneeze, or you drink a glass of milk and you start to cough and you have phlegm in your throat immediately. Your body's having an aggressive immune response. Most of us know these, so rarely do we need to test for these. But the next category, called the type 2 reactive antibodies, these are delayed allergies, reactive types, IgA, IgG, and IgM. And then the type 3 complexes, immune complexes, that are more delayed, as well as the type 4 T-cell mediated. These are more difficult to identify, but we have a test that can do that, so you can find out what's happening in your body at a particular time, because time is the issue here, right? The hidden immune burdens, delayed hypersensitivities and allergies, they're hard to identify. The symptoms may occur in 3 hours, or the next morning. Maybe you wake up with a headache for something you ate the previous night. Or it could be even as much as 3 weeks later after you've been exposed. Symptoms may not even be noticeable. However, they still put a burden on your immune system, setting the host up for advanced diseases like I had, a crippling form of degenerative arthritis. The tests of delayed hypersensitivity type are the antibody test, the particle size test, and the lymphocyte response assay, our hero test, the Elisa test. This is one that is our most favorite. Let's talk about each individual one. Antibody test, this is the most common. It's the most popular, most inexpensive. The unfortunate issue with this is, even though it measures the presence and amount of specific antibodies, you don't distinguish the antibodies that are causing symptoms and the antibody reactions that we would like to protect us. The result is a huge list, a long list of items that we need to avoid that could be causing problems or not causing problems. and certainly this, most of the time, is the ones that aren't causing problems. And we've spent money on a test that didn't give us value but made us miserable because we tried to eliminate everything from our life in the form of food. So the cell test size, this one is rather interesting. It is automated cytotoxic test. It's a device to measure particles in the blood and their size. Any particle that's detected larger than 10 microns, not just reactive lymphocytes. So it can pick up on anything that gets in the bloodstream that's larger than that. It could be platelets, it could be heavy metals, toxicity, but there are no other particles in blood that are 10 microns. Not really an allergy test at all, just measuring particle size. Let's look at our big daddy of all of the lymphocyte response assays that are out there, the one and only, the Elisa. This is directly observed lymphocytes. I'm going to show you some slides of how these technicians look at the blood and identify. It's rather interesting. Under conditions of ex vivo, we try to mimic very similarly what's happening in the body and put it in the slide so that we can mimic and understand what the immune system is doing. Quite fascinating technology, how they do this. It covers all three types of delayed allergies. So it's going to get about 85 to 90% of what your immune system is doing, and the other 15% you already know by what you've responded to aggressively. This advanced method yields a very accurate method. It's very few false positives of less than 0.1%. Here's a picture of what the cells will look like under the microscope. On the left-hand side, this is a non-reactive lymphocytes that are not upset by what they've been exposed to under the slide. So your blood is introduced on different titers, and the technician looks at it for these reactive lymphocytes that glow. As you can see on the right-hand side, the reactive lymphocytes and this 600x magnification, you can see many of them glowing there. This individual is extremely sensitive to whatever antigen was presented there on the slide. So being that it has more accurate results, the only items causing immune reaction are identified. Fewer and only correct items to avoid are on your list there, and easier to stick with this type of program. A rotational diet is provided to help you avoid any further immune sensitivities, and then obviously we're going to experience better outcomes that are proven, and I want to show you some of that. This is a research article in the Journal of Musculoskeletal Pain on fibromyalgia. A novel treatment for fibromyalgia improves clinical outcomes. In a community-based study, they experienced over a 6-month period just watching their food items that they tested positive for, eliminating those following their ELISA protocols, 50% less pain, 70% less depression, 50% more energy, and 30% less stiffness. A big reason why I'm very attracted to it, because of the stiffness that I had that's so severe. Another proven outcome journal, and this has been quite some time since this one was published, but the accuracy is still there, and there's more than 50,000 cases over 25 years that have been utilized to give this information in this particular journal called Diabetic Medicine. In type 1 and type 2 diabetes, there are proven successful outcomes. The reduction in the hemoglobin A1C, which is a 3-month blood sugar average, I would recommend that you get that done at least once a year. Twice a year would be more ideal. Mean reduction in insulin in type 2 patients of type 2 diabetes, and then fewer hypoglycemic episodes were encountered where the blood sugar would drop low and they would feel rather miserable. So, as a result of this education for you, we're going to provide 10% off the ELISA comprehensive test for not just this week only. That is actually, did not change that information. It is going to be all the way through July. So here it is in late February, almost in March, and we're excited that you have this opportunity to get tested so that you don't guess and really know what your immune system is doing for you and can continue to defend you from illness and disease and repair the body because you're fearfully and wonderfully made. God hasn't forgotten. He knows exactly what you need. He will always be there for you. He designed you in His image, in His likeness. You are Jehovah Rapha's most blessed creation. Thank you all for watching.